Hey, good morning. This is Steve Stites, quarterback of the Kansas City Chiefs. Not really. No chief medical officer, though, here at the University of Kansas Health System, and that's almost as good. We're broadcasting live with you from the Dolph Simons Family Studio. It is Red Friday. We are ready for the Chiefs' Super Bowl victory, and we have a fun update planned today. Amanda Cackler is in Studio B to help answer your questions, and we're going to be talking about safety during this weekend's watch parties, because you are going to play it safe. You've kept the Chiefs safe. The Chiefs are going to win. You're going to win. You're going to play it safe, because that's the best way to celebrate this Super Bowl victory. But first, Dana Hawkinson, Medical Director of Infection Prevention and Control. How are the numbers today?
You're the medical quarterback of the health system. How about that?
I don't know. That's a kind of funny one. I just like my Patrick Mahomes jersey.
The numbers this week continue to be really good, and I think we're really happy about that.
We are excited.
I think that's the same thing for other hospitals around the city as well. But currently, we have 30 active inpatients.
We're so close to the 20s again.
I know. That's nice. 10 of those, so a third of those are in the ICU, and only 4 on the vent. We still have 59 patients in that recovery mode, and 4 on the vent there as well. Hayes is doing pretty well. Also, they have 17 total with 7 active and 10 in that recovery period. So overall, here and at Hayes, I think we're pretty happy with the capacity and what the numbers are for the active inpatients. And not only that, but we had talked about earlier in the year, early in the week, it's not just the census numbers, it's the new admissions that we're doing every day. And certainly we're even down those new admissions from yesterday for those active patients. So.
You know, those are really great numbers, and it is exciting. Rock Chalk, Kansas. Well done, Kansas City. Or go Chiefs,
well.
go KC.
I think people are changing.
It is
changing
awesome.
Their behaviors.
It's awesome. And I think right on top of the Super Bowl, don't let us see a spike after this. That's really important. All right, well, let's talk a little bit about how we're going to handle ourselves on Sunday as the Chiefs win, because every Super Bowl party has to include great food. And while we take our celebrations seriously, we also have to take them safely. We recognize that it's also Heart Month, and our responsibility is to remind you to eat healthy. We have Sheriff Eric King here today. He has selected 2 of the many great recipes you sent us. Come on over, Chef. Let's talk a little bit about what you brought over and what you have for us.
All right.
I'm kind of excited about this picture already.
Yummy.
All right.
My name is Chef Eric, as they like to call me around here. I've been here with the health system about 3.5 years. I am the chef director, overseeing all of dietary production. So you'll see me running around all over the hospital from D&G, Cambridge Tower, and back again.
Yeah.
So we selected some different recipes today based on submissions. The first one we have here is for you today. It is presented to us by Lauren May.
I like it already. I'm smelling it. It smells so good.
It's a healthy artichoke
really good.
So being it's Heart Healthy Month, we want some recipes that are a little bit healthier. You know, it's Super Bowl. We're going to be eating all day, so if we get some healthier options, it'll help us out a little bit. Now, I know you don't like spicy food, and I will warn you, it does have a little bit of garlic in it, so be very careful.
I tell you, I like spicy food, but it doesn't love me back.
That's a big one right there.
That is not the right kind of love-hate relationship. You know what I'm saying? It's kind of like one of those, that's the girl you dated in high school or something. So. Okay, so I also love chips, by the way.
Yeah.
These
chips are good.
Are a key part of life. So I'm going to take my mask off for just a second while I take a bite of this food.
Now, this recipe was submitted by Lauren May. Her son, Judah, was here in the health system for some heart surgery. I believe he had 4 different heart surgeries.
Wow.
So he's doing great nowadays, very strong. But this is a family favorite right here they submitted.
Here we go. Uh-oh. I got to break through the... There we go.
Looks like I have to get some stronger chips next time.
I know. I'm just going to put my fingers in. Is that okay?
That's quite all right. It's your dip.
It's my dip, and I'm going to have it with a little bit of the... I love the yellow peppers especially. Okay.
We went as close as we could to the cheese colors.
Oh, no. It's really, that's perfect.
So this artichoke dip has cream cheese, non-fat Greek yogurt, Parmesan Reggiano cheese, minced garlic, with frozen spinach, marinated artichoke hearts. We throw all that together, bake it in the oven, then put a little bit of mozzarella cheese on a dish and finish it off.
That is awesome.
And, you know, for non-fat Greek yogurt and everything we put in there.
That's got a lot of flavor. That's really good.
Not too bad, huh?
Oh, it's more than not too bad. That is
even with the garlic.
First down, Kansas City.
And for our next dish, a little bit something spicy, so we selected this one here for you. It is our buffalo cauliflower. It's a crispy buffalo cauliflower bite. Also comes with a non-fat Greek yogurt dipping sauce.
Okay.
So what we did is this was submitted by Leslie McGuire. She's a breast cancer survivor. Of all the submissions we got, we had some great stories, and so we really wanted to bring those to light today.
I love cauliflower.
She serves these with a combination of a Greek yogurt, lemon, and chive.
Yeah.
And it's just Greek. It's just fat-free yogurt.
It's good.
We take cauliflower, put it in medium-sized bites. We toss it with a garbanzo bean flour, a little bit of water. Bake it in the oven about 15 minutes. Take it out, toss it with a little bit of buffalo sauce, a little bit of melted butter. Throw it back in. Sauce right here just has the yogurt, a little bit of lemon, a little bit of chive, dill, a little bit of salt and pepper.
It's really good. The key is the buffalo sauce.
Oh,
That makes it taste better.
Don't you?
Yep,
There you
yep.
go.
And so not so guilty after you stuff yourself silly on Super Bowl Sunday.
Correct. A little bit healthy.
All
A little
right.
bit healthier than.
This is good stuff to eat, and it is heart healthy. And I think that just means this is going to help bring the win home for Kansas City. And what we really want to hear is our great radio announcer, Mitch Holta, say, touchdown,
That's right.
Kansas City, many, many, many times on Sunday.
Would you like me to leave these up here for you?
Oh, I think that would be awesome. I suspect we
Fantastic.
could snack
Enjoy.
a little bit left throughout the day and I may even take it back to my office.
It'll be a good breakfast.
Yeah, were you expecting this to come back or something?
Oh no.
Okay, good.
I just
Good.
want the plates back empty, that's all.
Oh,
Thank you so
thinking
much.
about the plates. Huh? Thank you, Chef. And thanks for being part of our family here at the University of Kansas Health System. Really appreciate your work and the great food we have. And I, you know what? Actually, I eat here a lot, so I can testify to it. So thank you so much for your great work. All right. We've had a little bit of fun with this, and it sounds like we are ready to move on to the next question. Are there reporter questions out there this morning?
There are. Good morning. Cody Holyoke, Channel 9.
Hi, Cody.
Glad Dr.
Are we-
Stites has his coffee today.
Oh, man. Hey, listen, just real quick, though, Cody, are we talking Chiefs football or are we talking COVID?
We're going to talk COVID first, because I know you're going to get to
Fine.
Chiefs.
All right.
I mean, it's all kind of related, but
Yeah.
with Johnson & Johnson now applying for EUA, I just want to get your take on that, especially as now state analysts, especially in Missouri, are seeing what they're calling a vaccine desert around much of the populated areas in KC. I'm curious your thoughts on that.
Yeah, so the problem we have is a vaccine supply. So I think the more good vaccines we have that can help us take care of folks, the better. And I think the Johnson & Johnson one is another good addition. It doesn't have quite the same high degree of efficacy as Moderna and Pfizer, but it is still a very good vaccine. And we know that, and my guess is that, we've said this before in the program, one shot, some in the U.S. was 72% effective overall, 68% effective. But if we look at the U.S. data, say 72% effective, that's good data. That's better than the flu shot. That actually, if we hadn't been spoiled already by Moderna and Pfizer, we'd say that's amazing.
Yep.
And it really prevents serious infections. The threshold for what we call infection is very important when we talk about efficacy. So in this situation, the J&J vaccine is still really, really efficacious for serious infections. So I'm really excited about that. And I think as we get supply up, almost all of these vaccine questions are going to go away. There is a problem of distribution. It's true in Kansas. It's true in Missouri. Oh, wait, it's true in 50 states. And so I wouldn't just single out Missouri or Kansas in that regard. And also, I think part of the problem that we're seeing, there is a problem in data reporting. And for example, we got our information, which KDHE said, this is how many shots you've given. And we're like, oh no, we've given a whole lot more than that. And so it's a data reporting issue. And so I think that we know on both sides of the state and really throughout a good part of the country, that's the case. And I think that everything we can do to get more quantity of vaccine into the pipeline, the better we're going to do as a country. Hawk.
Yeah, I think the key point here is, as you stated in your first point about the efficacy, is the reduction in severe disease and death. And that's what we're looking for. And that goes with it, the reduction in taking our hospital capacity and keeping people out of work and all of that. So I think that the efficacy question is more of, but do you prevent hospitalizations and death? And that's what that preliminary report and that data has shown, that it does do that. Yep.
All right.
Quick follow-up to that, if
Yes,
I
sir.
can. When we talk about Johnson & Johnson and the lower efficacy, I've heard a lot of people, viewers, people on Facebook, saying, well, that's a lower number. And like you said, we're spoiled by the first two. How do you beat back that different kind of hesitation, saying, I'm going to hold out for something with a higher efficacy?
Yeah, that's a great question. I'm going to turn to my other two experts first, and then I'll offer my opinion after they teach me here. Hawkeye, what do you think?
I would say if you get offered a vaccine, which is EUA, emergency use authorization, or approved, you should take it. Again, what we have is, so far, all of these candidates really look to be very good at preventing severe illness and death, and that's what we're trying to do, is protect you, your friends, your loved ones from those horrible outcomes, and that's what all of these seem to really do.
Yeah.
So I think that if you are offered a vaccine, you should go ahead and get that vaccine.
What do you think, Amanda?
With Dana, we were hopeful to have a vaccine that was going to be above the 50% threshold, and we've got 3 different options out there that are above that. So I think, again, to Dana's point, if you're offered a vaccine, don't hesitate to jump at that opportunity.
And the other good thing, remember about the J&J vaccine, is it's a one-shot vaccine.
One dose.
So I think that may actually entice some people to do that. Now, some folks may say, I want to wait to have the Moderna and the Pfizer vaccine. Okay.
Mm-hmm.
If that's your thing, I think, Godspeed, go and wait. But remember that carries risks. You're still going to be more susceptible than all the people who got that vaccine. Second of all, J&J does prevent, I think it was 85 to 90% efficacy for serious infection.
Yeah, that's the key.
So that means if you're getting admitted to the hospital, you need oxygen, you're going to the ICU. So you get the right goals even by getting the J&J vaccine. And it's a one-shot routine. And it's also easier for us to keep refrigerated. So I think there's a lot of things to like about that. I would also add that it may well be, because I think the FDA is going to ask J&J to do a follow-up study where they do a 2-shot regimen to see if they had 95% efficacy.
Yeah.
I suspect what we're going to find out, remember we've been saying this for a couple of days, Moderna and Pfizer turn out to be about 70% efficacious on a one-shot deal anyway. They're probably all the same number. And so the reality is, I think you're going to get highly efficacious protection from the J&J vaccine. Mm-hmm. It's a one-shot vaccination, so for hard-to-reach communities or people who don't like getting shots, et cetera, it's a great choice. And the third thing is to remember that this level of immunity protects you against serious disease, and that is incredibly important because that's what's going to help us heal as a country and will help us stop the spread of the coronavirus.
And do you remember what our in-hospital mortality rate is? Is it 7% still?
No, it's about 9.4%.
So it's pretty high.
It's
so
high.
The overall case fatality rate for coronavirus, COVID-19 in the United States, based on Johns Hopkins website, is 1.7. So that's just all of the cases. But as Dr. Stites just said, if you come to the hospital, your chance of mortality is 9%. So that is quite a bit over that 1%. So what these vaccines do, and so far the data that we've seen from any of these vaccine candidates, is overall protect you against that severe disease and death. And that's what we're really looking for.
Amanda, any thoughts with that also?
I think we're going to get to this a little bit later with the questions, but to Dana's point around preventing severe illness and death, it doesn't necessarily mean it's going to prevent you completely from having contracting COVID-19, but hopefully if you do, you're going to have less severe symptoms. And so I think that's really important to keep in mind, and the importance of maintaining the infection prevention and control pillars.
All right. Other questions?
Hi, Jamie Jackson from Cake News in Wichita.
Hi, Jamie.
I wanted to know. I wanted to know, with rates across the country, COVID rates and hospitalizations dropping drastically, what are your thoughts on that? What are your thoughts on why that's happening? Health experts seem to be kind of going in a couple of different directions, but I'm curious to see what you all think about that.
You bet. I'll turn to my panel here as well, then I have some thoughts. But first of all, it's great news. And second of all, there's no one answer, I don't think, Amanda.
Yeah, I think we've seen that folks are taking it extremely seriously, and their behaviors of limiting participation in big events, masking practices, good hand hygiene, staying home when folks are sick. I think we are seeing the effects of that and hope to continue to see that trend. Obviously, we've had the vaccine introduced now, but I don't think enough folks have been vaccinated for that to be the key factor into why our rates are lower than they were.
Yeah, I would agree with Amanda. I don't think that the vaccination is significant right now just because the number of people that have been vaccinated. And we know, we've heard more stories. And the first question was about that, the vaccination desert. We know that minority populations have been disproportionately affected. But we know that those populations are also unable to really get the vaccine unless you're an essential worker or have been a healthcare worker. So I don't think vaccinations are as significant right now. Hopefully they will be as we continue to move further into this and get vaccine supply. I think it's mostly behavioral, and we've talked about the behavioral things, and it goes with those pillars of infection prevention. So I think it's behavioral. I think it's the culture change that has continued to occur as well. Those are probably the biggest factors rather than vaccination itself.
You know, I'm a frequent traveler to the Missouri Ozarks. I love to go fly fishing down there. And just a couple of quick thoughts. First, for a long time, people didn't take this seriously. I didn't take that seriously in Kansas City as much. And you'd go in, you'd see people weren't wearing masks. Today, when I walk the streets, I'm down the plaza or go out and run errands or something, everybody's got a mask on. I think it's improved dramatically. The second thing is, and this is not great news for restaurants, but the lack of outdoor dining in which people felt, I think, like they could just take their masks off has been a bit of a change. And I think now that it's indoor dining with spacing apart and people are just more serious about masking, I think that's been better. When I travel through Missouri or Kansas, masking is better. I'm not saying it's perfect, but it is better. I think school districts got it figured out. I think college campuses kind of got this figured out. I think we've kind of gotten it figured out and we're better at it. What we can't do is relax or get cocky because we still all have to get vaccinated before we're going to be really safe. And those days are coming, and they're probably going to come, soon if we can get more vaccine in. But soon may be relative. It may be another 6 or 8 months. But it's certainly going to, I think it'll be a lot less time than we've already spent in this crisis. I think it all comes down to behavior. The one thing I would also say about hospitalizations is that 75 to 80% of nursing home patients have been vaccinated. We are seeing a clear drop in ICU. And I think I think that vaccination is having an effect on hospitalizations in the elderly because we are seeing better vaccination rates inside nursing homes.
Yeah.
So I think that's going to be a big player for us as well.
Definitely a significant proportion of those nursing homes.
Yeah, I think that's important. But it's a
And
combination.
just real quick,
Please.
my apologies, just to follow up on that. I know everyone's excited about the Chiefs' big win. Is there concern with the upcoming weekend that despite rates and numbers dropping so drastically, that we would see an increase, not just in Kansas, but in different parts of the country as well, if folks, kind of are a little lax about their celebration plans or who they're around? What do you think that would look like? And are there any preparations that cities in our area or local governments, is there anything they need to do to prep just in case that happens? Or is it, let's just wait and see?
Yeah, I think it's all about personal responsibility. At the end of the day, this is about people behaving and following the rules of infection control. Don't get cocky because the numbers will go down. Because the fact is that if we had said we had 30 patients, we would have said in June and July, that's a really high number. Or in August, that's a really high number. So we're still at widespread community transmission. That has not ended. Coronavirus or SARS-CoV-2 is still circulating broadly in our communities. The variant is now out there. This is going to be a test for us. We need to pass this test. And we know how to pass the test because we've been studying it for 10 months. And the studying says, wear your mask, keep your numbers down, keep your distance, stay inside, don't relax and feel like just because it's a Super Bowl, you have permission to go out and party in a way that's going to spread coronavirus. Follow the rules of infection control, ace this exam, and watch the Chiefs ace the Super Bowl.
Yeah, and I think, we've talked about how coronavirus or COVID-19, you have to really pay attention to the local infection dynamics. And, we do have the Super Bowl. It is an event. People around the nation hold parties and get-togethers. I wonder if this year it may not be as much unless you're in Tampa or Kansas City. So we are definitely encouraging people, do not get together and hold those Super Bowl parties and those get-togethers. Don't mix your bubbles, because it's not just that party. And we wouldn't necessarily see a spike in a week or two, but it's 2 or 3 infection cycles down the road where we would see a spike. So again, everybody continue to be smart, do the right thing, and hopefully we won't see another large spike due to this weekend's events and celebrations.
Amanda, anything you'd add?
Something that I noticed a couple of weeks ago before the other big game was the grocery store. The volume of folks that were grocery shopping prior to the game was it was different than what I had seen. I mean, I remember having moments where I was like, wow, there are a lot of people in this grocery store. There were lines backed up through the aisles. So if you are planning to prepare any kind of food and you need to make your weekly grocery run, maybe plan a little extra time so that you can be prepared for separating yourself from other folks if that pattern holds true this week before the game.
Totally. I go at 7:30 or 8 a.m. on a Saturday morning. It's like a ghost town. It's perfect. All right, other questions? Jill, let's go.
Okay, before we go to our first question that we have on here, I just want to ask you real quick. People are wanting to know about how you feel, what the percentages are on the adverse reaction. Has anybody died from taking the shot? There's just kind of, everybody's sort of worried about you.
You bet. So I feel great. I'm back to my normal annoying self. I got the shot on Tuesday. I felt fine until about 8 p.m. I got the shot about 8. You saw me here at 8 a.m. on Tuesday morning. By about 8 p.m. Tuesday night, I was feeling kind of crummy. I had some chills. My temperature got up to about 101.8. And I thought, this is what they're talking about. You feel like you just got run over by a truck. So I told one person, I said, I'm looking for the license plate tag so I can turn that driver in. Then I was chilled all Tuesday night. And then Wednesday morning, I saw a temperature of 102.5. So I took some Aleve. I took some Tylenol. And, late afternoon Wednesday, around 5 or 6, I started feeling a little better. And I think I could have come to work at that point, or I probably could have come to work in mid-afternoon on Wednesday, but that didn't make any sense. So actually, I worked all day Wednesday. I did it from home. I was on Zoom meetings the entire day. And then Wednesday night, I ate dinner and went to bed. And yesterday, I was back to work here at 7:15 in the morning like normal, or 7 a.m., just kind of like normal. Went on the program because I had some other commitments I had to be part of yesterday morning. And in fact, I have to leave at a certain time this morning, so I'm going to go back to some of those meetings. But I feel great. And my shoulder's not very sore. So, really it was a 24-hour thing. It's like that 24-hour flu bug or something. And I think that's how I felt. Hawk?
Yeah, and overall we know nobody has died. That question came up. Nobody has died.
Nobody's died.
This is a very safe and efficacious vaccine. So again, continue the
and
message.
by the way, you can get the same thing with the flu vaccine. You can definitely go with Shingrix vaccine for those of us who have to get protected against shingles because of a certain age, et cetera, or other vaccines. So it's not that uncommon. I think part of it is it's the booster thing. It's 4 weeks apart, and so it shouldn't really be a surprise. It wasn't a surprise to me that I got it. A lot of people have had it. You're going to be fine. You're going to recover from it. You don't really have the virus. You have an immune reaction to the fact you've been injected.
Yeah, that's exactly right. So if you are given a chance to get the vaccine,
don't
take
be
that
worried.
shot.
Amanda, other thoughts you have?
Yeah, this question I believe came up the other day, but the question from the community was, do you think you're contagious because you were having these symptoms? And I think the answer to that, and we have to continue to remind folks, is that it's not that you have COVID-19. You are experiencing the inflammatory response to the vaccine.
Yeah, I actually checked with my two partners here and said, hey, guys, do you think I could actually come to work? And they're like, well, you could come to work. And then I thought, that's stupid. I'm just going to sit here and Zoom because I have on a down coat over my vest, over my clothes to stay warm.
Yeah.
Because you're febrile. When you have a high fever, you just don't feel very good. So I thought nobody really wanted to watch me walk around the hospital in a down coat and a mask. I thought that would be kind of a doggy downer.
You could have had mittens like Bernie.
I had a pair of mittens on for a while. They didn't look like Bernie's, though.
Okay.
Yeah. All right.
Okay, I'm a health system patient, but I live in Missouri. Is that a factor in why my name is not being selected to receive the vaccine?
Yeah, not at all. We take everybody over the age of 65. We randomize them. The problem is there's about 80 or 120,000 people on that list that is randomized, and we've had about 2,000 doses to give to patients. So the reason you're not getting the vaccine is the same reason you haven't won the lottery yet. The odds are against you so far. The odds will get for you as we get more vaccine, and that's really the answer, Amanda, I think.
Are symptoms,
I'm looking at Amanda. Anything else from your standpoint?
No.
Okay.
are symptoms different with the new virus variant? Do the vaccines work against it?
Team?
Yeah. I don't believe that there's any difference in clinical presentation. There is some evidence or signal apparently of increased mortality or severity, but we don't know the full data set behind that and what the CDC is seeing. Hopefully they will present some of that. Do the vaccines work against it? There is press releases out by the companies that show that, yes, their vaccines do work and do have efficacy against B117, which is the UK variant, and then the South African variant is B1351, I think. So there is still efficacy against that. And I think mostly what they're looking for, those are in vitro studies, meaning in the lab, and they're also looking at the antibodies and neutralization. But the vaccine efficacy is based on more than just that antibody as well. There are also other antibodies associated with those spike proteins. There are T-cell responses as well. But the best evidence we have, unfortunately, right now just comes from the companies itself saying during their laboratory experiments, there is still efficacy and neutralization of those new variants so
And was
far.
it AstraZeneca or J&J that presented data that said, yes, we're not as efficacious against overall, but we are still highly efficacious
Yeah.
against serious disease in South Africa,
Yeah.
including the patients who have the more difficult variant there?
I think today I saw AstraZeneca did it, but recently J&J may have as well.
Yeah.
So a lot of them are trying to get out ahead of it. And so,
Amanda.
Sorry, I'm like waving at you. I have something to say.
You know I'm coming.
yeah, we're coming to you.
I think a critical piece of information here is that the prevention strategies are the same regardless of the variant. So that's why it's so important to continue to wear our masks, to wash our hands, to stay away from large groups. We've also seen this impact our flu rate. So to date, and I think, Dana, unless you know otherwise, I don't think we have had a positive flu test run here within our lab, which is incredible.
Crazy.
Yeah.
I don't know that we've ever had a year like that. So it's demonstrating that these infection prevention pillars don't just impact COVID, it's also impacting our flu season.
Which I think actually, remember the question earlier that said, why are the numbers down? I think the influenza is proof that we're right. Because with the numbers so low on influenza, that's okay, we got a flu shot, but we've also had a lot of cases despite flu shots. It's infection prevention and control, right? It's your world, Amanda, that has been successful. When it can blunt influenza, it's blunting coronavirus. That's really the key. The rules of infection prevention and control travel with you wherever you go. Jill.
All right. Does the current COVID-19 PCR test detect the new variant?
It does.
Yeah, there is some signal dropout because, well, first of all, there are different PCR tests. There's different companies that make them. One of the reasons they found it in Colorado, which was the first state to detect the UK variant, was because there was an S dropout. What that means is the PCR to the S protein, the spike, kind of dropped out. But most of these PCRs have two different targets on fairly conserved region. So we do have conserved regions as well. So far, there's no evidence that our PCR tests do not detect the new variants. But initially when they found it, there was one of their targets on the PCR test that kind of dropped out or didn't give a signal because of the mutations. But right now, we don't see that or have that problem. But certainly initially in Colorado, they were able to detect that they weren't seeing it. But again, the biggest thing about this is that most of these PCR platforms have two different targets. One is S, and then the other is other conserved regions as well. So hopefully those will at least pick it up. And then in the lab, if you have astute laboratory workers or managers, directors such as Dr. Leisman, they will be able to detect those if that should happen.
I had a friend who received one dose of the vaccine and then tested positive for COVID-19 1 week later. How does that happen? And adding to it, we have people on the thread this morning that want to know, if that happens, do I wait to get my second dose?
All right, those are two good questions. Amanda, we got to have patience, right? Because just because you get the first shot doesn't mean you have protection immediately.
That's right. And even if you get your second shot, it doesn't mean that you're necessarily protected from getting COVID-19. What we're hoping for is that if you do get it, you have less severe a response, and that that's the intention behind the vaccine. So again, and we've seen this through everywhere that has received vaccines, folks are ready to kind of lighten up their protective practices, and we can't do that. We can't let our guard down at this point. So is there a chance that you could still get it? Absolutely. It still goes back to your behaviors and taking personal responsibility for prevention.
And I think you just hit the point. It's worth emphasizing. It's just like with a flu vaccine. You can still get the flu. You're just not going to get sick. You can still get COVID-19. You're just not going to need to be hospitalized. And you may even not even know that you had it, which is why the infection prevention control techniques and wearing a mask are still so darn important, because you don't want to spread it. Because if you stop spreading this disease, it can't mutate. It can't pass from one person to another. And then it kind of fades away, right? That's the good news. If we get vaccinated and do it right, Hawk, this thing's going to go away.
Yeah, and we should make note to the general public too. This was well studied in Moderna and Pfizer trials, and they have it. The graphs, you can Google them. They're really interesting graphs and show vaccines do work. So they looked at it, and by about 12 or 14 days after the vaccines, you started to see a separation of the curves of the amount of people that got infected. So people were still getting infected, especially within those first 14 days or so. But after that, the amount of infections in the people who got the vaccine versus the people who didn't significantly changed and was quite different. So we understand that, and that was well studied within those trials. People were still getting infected, especially within those first 12 days after that.
But Amanda's point, vaccine is not a license to stop wearing a mask, because there's still a lot of COVID out there.
Would it be safe to gather with 6 to 8 people indoors if I'm 2 weeks past my second dose of COVID-19 vaccine?
Amanda?
So I think if these are the 6 to 8 people that live in your house and they're part of your bubble, it's probably okay. Again, the vaccine should not change our practices at the current time. So my answer is going to be, is it safe? Nothing is perfectly safe right now. If you can continue to wear a mask, socially distance, it's going to reduce the likelihood or increase the safety. But is it completely safe? I think the answer to that is no.
If I was exposed to COVID-19, how long should I wait to get tested?
If you've been exposed to COVID-19, how long do you have to wait to get tested, Hawk?
Yeah, so I think you would be, if you're a known exposure, you'd be in that quarantine, that close contact, so you have to quarantine. Obviously, we know that the quarantine dates and duration has changed. I would probably do it more in that 5 to 7 day range before getting tested, and I would try to do the PCR test rather than the antigen as well.
At what point does the loss of taste or smell happen with COVID-19? And my daughter, actually, she uses that all the time, doctor. She'll say, I'll go, you have a runny nose. Have you been tested? Mom, I can still smell.
Yeah.
Well, just remember, it doesn't happen. It happens about 40% of patients,
Correct.
but that's 60% patients don't have it, Amanda. What do you think?
Yeah.
Yeah, I was going to say it's not a telltale. I mean, everyone's response is a little bit different. So just because you still have taste and smell doesn't necessarily mean that you don't have COVID. And if you have COVID, doesn't necessarily mean that you're going to always lose your taste of sense or smell. So I don't know if there's been studies that suggest the time frame for those that have experienced that, at what point in time they developed those symptoms.
I mean, anecdotally, I've heard people who develop it first before anything else. Or otherwise, some will develop it 3 or 4 days into illness. I don't think there's any significant time frame. And to your point, it's not everybody who gets COVID-19 will lose their taste, their sense of smell, or what we call anosmia. So you just can't tell. But there's no specific time frame.
By the way, your beads look good this morning.
Thank you.
No, that's cool.
Last question. Is it safe to be around someone who has had COVID-19? If yes, for how long?
Is it safe to be around someone who has had COVID-19, but I'm going to interpret that meaning, but doesn't currently have it, has had in past tense, Amanda?
Yeah, so again, I think this is regardless of whether you know somebody who's had it or you don't know if they've had it, it comes down to, are they in your bubble? if they're not in your bubble, then the recommendation is to keep your distance, reduce that likelihood of spending long periods of time with someone within close proximity, especially without a mask on. Is it safe to introduce somebody new to your bubble? The answer to that right now is probably no, but can you do things to reduce the risk of transmission when you do so? And the answer to that is yes, and that's maintaining good social distancing, wearing your mask, washing your hands. If either one of you have signs or symptoms of any illness, not getting together. So it's not the greatest answer, but is it safe? Nothing is 100% safe.
Yeah, and just remember CDC guidance is if you've had it, you really should be safe to go back into society after 10 days after you first had your symptom onset or your test date. So
yeah, so the rules travel with you wherever you go.
yeah.
All right. Hey, Monday we look at the prevalence of heart damage among student athletes who have had COVID-19. Dr. David Smith, Medical Director of Youth Sports Medicine, and Dr. Tim Beaver, our sports cardiologist, are going to join us. They will also talk about how we're going to be back involved in spring sports. Folks, final thoughts. Amanda, what do you think?
Well, Dr. Fauci said celebrate the Super Bowl with your household. So that would be my recommendation, is to cheer very loudly with those folks that live in your household.
Absolutely. Hawkeye?
Celebrate smart this weekend. Don't mix your bubbles. We want to see you all here for next year when the Chiefs go back to the Super Bowl.
And win again.
So be smart. We are waiting for Johnson & Johnson. They've applied for the EUA. Hopefully, if it gets accepted, that increases the supply, and soon everybody will be able to get their Fauci ouchie.
The Fauci ouchie. Yes, I love that. That's the line of the day.
Yeah.
I thought my calling myself a quarterback was the line of the day. That's the line of the day. Fauci is the man. Hey, not wanting to jinx our chances on Sunday, our NICU staff, some of their families and employees who also volunteer for our Rock a Baby program, took these creative photos of our newest and tiniest Chiefs fans. Celebrating holidays, special events, and big sports moments like the Super Bowl with our patient families is important. You can see each baby's personality coming right through, even this little guy with his Tyreek fingers. The fun and the photos mean so much to both the NICU staff and their patients. Each baby received a card with their tiny footprints that reads, "My first Super Bowl." Not sure how much the babies enjoyed it, but we are enjoying these spirited photos right now. Hey, as we sign off for the weekend, we're going to hear in just a moment from our 18 deserving employees who are going to the Super Bowl in Tampa, courtesy of the NFL and the Chiefs. And you'd say, gosh, you guys have been talking about infection prevention. How can they do that? Here's how they do that. The Chiefs have done an amazing job of keeping Arrowhead Stadium safe. I don't think there's been a reported case of transmission at the Chiefs Stadium, and you have to have a negative test before you go in. I mean, they do all sorts of things there to make it, especially in the suites and stuff like that. So the Chiefs have been helped in the design of the Super Bowl. And so what's happened is they've taken frontline healthcare workers who have had both vaccinations and had 2 weeks and finished 2 weeks before the Super Bowl and invited them down to go to the Super Bowl. And they have to wear a mask and they have to follow the rules of infection prevention and control. So to qualify, the folks had to have their vaccine. These folks are feeling a lot of emotions, and they're going to share their excitement as we say goodbye. So we think it's safe. We think it's going to be a heck of a good time, and we want to wish our employees the best. We want to wish you the best. We want to wish the Chiefs the best. And we know come Monday, we're going to be here to celebrate a Super Bowl with you. And as we celebrate the Super Bowl, and we support the Chiefs, who have done a great job in the COVID crisis themselves, as we celebrate all those things, make sure we celebrate you, because you followed the rules of infection prevention and control and kept yourself safe, your family safe, your community safe, and the Chiefs safe. We'll see you on Monday.
My jaw literally dropped.
We are sending you to Super Bowl 55 to watch our Kansas City Chiefs run it back. It is still all sinking in a little bit.
I just feel like there's so many other people who truly deserve this honor to represent not only our hospital, but just healthcare workers in general.
And when they put me to the side, I wanted to kind of just scream in the halls.
I have with me, if you can see it, your ticket to the Super Bowl.
Wow, what an honor. It doesn't even register yet. I'm definitely a Chiefs fan, but I'm a bigger one now.
All of us are getting the shock of a lifetime together. I feel like that's a big bond.
I'm a very diehard Chiefs fan, and I'm very excited to see them go back to back.
I got off the phone when I found out, and my son was in the room, and I turned around, and he's like, "Dad, you're crying." I go, "Yeah, these are happy tears, buddy."
Just to be acknowledged for everything that we've done, it means a lot.
This is going to be just a crazy experience for me. I've never been on a plane. Let's just start off with a bang. Let's just go. Let's go for it.
I got the phone call and was shocked.
You know what this is?
Oh my God. Yes.
I have never been to a professional football game in my life, so I am so excited.
I'm ready to go have some fun.
My first official job is to cheer really, really loudly and make sure that it sounds like there is a stadium absolutely packed full of Chiefs fans.
You are going to Super Bowl 55 to watch Kansas City Chiefs run it back, baby.
Oh my gosh,